Hi, everyone, and welcome to this installment of the Colorado State University Prevention Extension Cast. For today, we'll be discussing prevention program sustainability. So what is it and why is it important? I'm Dr. Nate Riggs. I use he, him pronouns, and I'm the Executive Director of the CSU Prevention Research Center. I'm joining you in my office on CSU's campus, where I'm happy to be joined virtually by Dr. Brian Baumgartner. Dr. Baumgartner is a Senior Distinguished Juvenile Justice Fellow in the Youth Development Program at Child Trends, the nation's leading research organization focused exclusively on improving the lives of children and youth, especially those that are the most vulnerable. Brian works at the intersection of research, public policy, and practice to improve outcomes for communities, families, and children. He's an adjunct research associate at both the CSU Prevention Research Center and the Penn State University Prevention Research Center, where we met just about 25 years ago, I think. So he's also an adjunct research fellow at the Criminology Institute at Griffith University in Queensland, Australia. And he's the founding director and original principal investigator of the Evidence-Based Prevention and Intervention Support Center, otherwise known as EPIS. EPIS is an intermediary organization supporting the scale-up of over 300 evidence-based programs and community prevention coalitions. So we'll get started here in a bit, but for those of you who have yet to join us for a Prevention Extension Cast, I'll be moderating a 45-minute Q&A with Dr. Baumgartner about the importance of sustaining evidence-based prevention programs. And after that, we'll have some time for Brian to respond to any questions that emerge from the audience. So throughout the conversation here today, please feel free to enter those questions into the Teams live Q&A, and I'll relay them to Brian near the end of the cast. And as always, I'd like to thank UST, National Institute of Agriculture, for providing funding to support this Prevention Extension Cast. So let's get started. And before I ask Brian my first question, Brian asked that he present a couple of slides as some foundational context. So Brian, I will hand it right over to you.
Great, thanks, Nate. Appreciate it. Thanks for everyone for joining us today to talk about sustainability and sustainment of prevention programs. As Nate mentioned, before we get into the questions and answers, I wanted to just kind of set the foundation for some of the things I'm going to say about prevention program sustainability by just kind of making sure we're all on the same page. I can't talk about sustainability in a vacuum. I can't talk about sustainability without talking about adoption and implementation. I work a lot in the area of implementation science, and we refer to it as implementation science because we're conducting empirical research and drawing on that research to influence practice. And one of the most clearly established tenets of implementation science is that implementation will not go as planned. Even in the best circumstances, there will be adaptations, there will be last-minute changes, and unfortunately, most of those adaptations will be reactive. So they'll represent drift from the intended delivery of the program. And as such, these adaptations, when they are reactive like that, they're likely to negatively impact outcomes. They reduce our confidence in the effectiveness of our programs. So I want to just lay that expectation out, right from the get-go. We should go into prevention work expecting that it won't go as planned. And so if we go in with the expectation that things won't go as planned, it precipitates our need to really do thoughtful pre-implementation planning. And so when we think about pre-implementation planning, we want to think about what some of these key implementation concepts and considerations are. And the first is that the current context is the foundation for any innovation. So we can't just think about the program or service that we're adopting and implementing. We need to think about the ground that we're planting that seed in, because that's going to have as much influence, the soil has as much influence on the successful growth of what we're trying to do as the seed itself. So we have to consider both of those. So how did we get here? Why are we doing this thing? How did we decide to adopt this particular program or service or innovation? What was the motivation? Who decided that it was the right decision to adopt this, to start this prevention program or strategy? And what was the motivation and for whom? So, think about that context, because that will ultimately have a great deal of impact on sustainability of our program or service down the road. Then we want to think about the characteristics of the program or innovation itself. So, one of the things that we've learned as prevention science has gotten more sophisticated in our understanding of the underlying mechanisms that drive the problems that we're trying to prevent or ameliorate, but as our understanding of those problems has become more sophisticated, likewise our preventions have become more sophisticated. We're no longer at the place where we think that we can significantly reduce adolescent substance use, for example, by having a motivational speaker come into the gymnasium and give a speech and throw out some tchotchke, if you will. Our ideas about what leads to poor outcomes for young people, for example, has gotten more sophisticated, and therefore our interventions have gotten more sophisticated, and that means that they're harder to deliver well and they're harder to sustain. There are more moving parts. So we want to think about, one of the moving parts is obviously the implementer or the practitioner or the workforce. And I'm sure that everyone on this call is aware now that post-COVID, we are really dealing with some workforce issues that we haven't had to deal with before. The workforce, the availability and the stability of the workforce is a real challenge right now. We want to think about organizational considerations. So the organization that is making the decision to adopt the program or service and deliver it, and what is the overall health and functioning of that organization itself. I'm going to talk a lot. I can't talk about sustainability planning without talking about organizational capacity. So you're going to hear me refer to organizational capacity quite a bit. And then again, the broader system, we can think of this from an ecological perspective. We want to think about the broader systems and the broader network of stakeholders who will be aligned or will be in competition with, who might support or not our efforts to adopt and implement and ultimately sustain our prevention programs if that's what we decide to do. And then again, obviously thinking about the implementation process and the infrastructure considerations that are related to that. And so along that line, I want to just mention that, from an implementation science perspective, we always look at implementation, adoption, implementation, and sustainment of a prevention program or strategy as a staged effort. So there are distinct stages that we want to be thinking about when we're asking questions about sustainment and sustainability. So we start out exploring the idea of some new program or service that we think we might want to offer. Then there's once we decide that that's the right decision, then we have a stage of installation. That's where we're just getting the program up and running. We're deciding, who we need to hire to deliver the program or service. We're deciding how we want to do outreach to get, let's say it's a parenting program, a family strengthening program. We need to decide what our outreach strategy is going to be to successfully get people to attend the program, etc. Then there's the initial implementation, and I'm sure everybody on the call has experienced the reality that the first time is the worst time. the first time you try to deliver a program, there's going to be a lot of trial and error. There are going to be a lot of things that we thought would be easier, and there are going to be a lot of unanticipated challenges. So the initial implementation and the irony is the initial implementation is usually what is getting funded. So our very first attempt at delivering this thing is usually what the spotlight is on. And then eventually after, let's say again, let's use the example of a parenting program or a family strengthening program that where we deliver several cohorts or cycles of that program. It's going to take a few cohorts until we really get it good, until we really have optimized our delivery of that program or that intervention or service. And that's the stage that we consider full implementation. That's the thing that we look at to say, does this work? Is it working? The question before that is, have we figured out how to do this yet? That's a different question from, is it working? Are we getting the outcomes that we wanted? And then finally, we've got that sustained implementation stage, maybe. And I'm presenting this as a linear progression where sustainment is mentioned, or sustainability planning or sustained implementation comes last. But as I'll describe a little later, it's really something that we need to be thinking of from the very beginning, from the very earliest exploration stage. So one other thing that I want to mention is that when we're adopting a new program or service, that's what I consider a period of innovation. We're adding something new to an existing ecosystem. So let's say the ecosystem is our provider organization, and maybe we provide a whole menu of programs and services. We're adding something new into that mix. As I said, that those early adoption and early implementation stages are really messy. We're just trying to figure out how to do this thing. And so that's the innovation phase of this. And that's a distinctly inefficient and expensive stage of the process. So it's really important to, as an organization, to think about, where does innovation fit in the way we do our business, in the way we do our work, because we have to be thoughtful. We can't be constantly innovating. We ultimately want to get to that, to the right side of that timeline, where we're seeing positive impact, optimized scale, and the biggest return on our investment. So this is just something to keep in mind as we're thinking about sustainment and sustainability planning. And so the last thing I want to just say is, go back to where I started, this idea of the context. So when over the next 45 minutes or so, we want to think about the context. When we're thinking about how do we sustain a prevention program, we need to be thinking about the broader ecosystem. What is the problem to be solved? What is the indicator to be improved? How do we know that? How did we arrive at the decision that we even needed this prevention program or strategy in the first place? How widespread was the understanding or the concern or the awareness about that need? Because again, that's going to impact who we rely on and who we partner with to sustain an effort. How was this particular program or service or innovation chosen? What was the decision-making process that led us to choose this particular strategy? Who was involved in that process? And again, so you can see I'm foreshadowing here that if you involve a lot of stakeholders in the decision to adopt a specific program, a prevention strategy, then you've got a lot of stakeholders that have an investment in sustaining that strategy if you make the decision, if you come to the decision that you want to sustain that. And then again, part of that is, what is the balance between extrinsic and intrinsic motivation? Meaning, is this something that we feel like all the effort is in trying to push this out to the intended audience, or is this something that an intended audience really wants and they're pulling it towards them? You're starting from a place where your target population wants this thing. That's going to have a big impact on whether you're able to sustain it long term, because you've got an audience, because you've got a market for that strategy. So with that, I will I'll stop sharing my slides and engage in some Q&A with Nate.
Yeah, thanks, Brian. That's really super helpful context, because I think a lot of times we think of sustainability or sustainment as the end point, as it's one, like a single thing, when what you described it as more of a process that is also influenced by innumerable contextual factors that we need to be aware of. So I think that's really helpful grounding for our conversation today. One of the things that I've become aware of over time is that we can think of and define sustainability in different ways, or there might be multiple components to sustainability. How did you define sustainability, and why does sustainability matter?
Right. So that's a good question. That's a great, fundamental, foundational place to start. What is sustainability and why does it matter? So in a perfect world, we would have a really detailed picture of the programs and services that families and communities need in order to thrive, right? And those would be the programs and services that we would provide through a perfectly aligned network of provider organizations and practitioners. Those programs and services would be well delivered by a stable, well-trained workforce. They'd reach all the people that needed them, and we'd all live happily ever after, right? That's the perfect world. Obviously, we don't live in that kind of utopia. What we really have instead, and no offense to anyone, this is just the reality that we live in. We have a kind of a patchwork quilt of provider organizations doing the best they can with what they have. And with prevention, when we're talking about prevention in particular, it's extra challenging because prevention funding is erratic. It's insufficient. We don't prioritize funding the prevention of poor outcomes. We prioritize funding the treatment or the intervention after things become problematic, right? Even though we know a lot about where, how these problems develop and what would work to prevent them, in most cases, we really, we give lip service to upstream prevention and we fund the after the fact treatment kinds of stuff. So we have this, we have funding that's erratic, it's insufficient. The workforce, as I said, is unstable. There's lots of turnover. A lot of prevention work is done as sort of entry-level work into a field, and so there's a lot of turnover in the people that deliver front-end prevention services. It feels like the goalposts are constantly moving in terms of what we are supposed to be doing, what problems we're supposed to be focused on, and what the solution du jour is. There's a lot of the newest fad in terms of what we're supposed to be doing to address prevention and to promote thriving among families and communities. And perhaps most importantly, both the evidence base in terms of what's effective and the needs of families and communities, they're both constantly evolving, right? So what we should be doing, what we need to be doing to prevent poor outcomes, what the needs of children and families are, or families and communities are, and our knowledge base about what are the most effective strategies, both of those things are constantly evolving and changing and growing. So that means that once we land on that sweet spot of a perfect program that really meets an important need and is having an impact, the last thing we want is for funding to run out and then we abandon that strategy and move on to the next thing. We want to be able to keep delivering that particular service. Again, once we've hit that sweet spot of the right program, achieving the right outcomes in a population where that program or service is needed. We want to keep delivering that service until there's no longer a need, or until a more important priority comes along, or a more effective strategy emerges. Right? We need to get to that. Like I said earlier in that graph on innovation, we need to get to that stasis, that level of stability where we're delivering that program in its most effective and efficient form. So that's the main reason that sustainment is important and valuable. The other important benefit is that, like I said, it takes time for any new program or service to get fully optimally implemented, to be in its most effective form. Those early stages of exploration and adoption and initial implementation, that are expensive and inefficient. So when we have a program or service that finally hits its stride, that's when we're getting the biggest return on investment. So that's why it's only at that point where prevention is really truly most effective and efficient and cost effective.
Great. So I think you previewed your answer to this next question very well, but I'll ask it anyway. When should communities then start planning on or planning for program sustainability, given that it is so important?
Yeah, I mean, obviously, you need to dedicate, again, I'm thinking in terms of a provider organization. You really need to dedicate time at the point of first contemplating the adoption of a new program or service. There's a set of questions you need to be asking. Why do we think this is needed? What evidence do we have that this is needed? Who all agrees that this is needed? And how will we implement it? How will we ensure that we have all of the necessary infrastructure and personnel and training and materials and resources to make sure that we are confident that we'll be able to deliver this program effectively? The next question then is, how are we going to implement, or how are we going to assess whether we're implementing it well and what impact it's having? And then ultimately, once we have all of those pieces in place, and again, this is at the initial contemplation stage. When we have all these pieces in place, we need to be asking ourselves, before we've even made the decision to adopt a program, we need to be asking ourselves, if it works, will we be able to maintain it? Will we be able to sustain it? You have to kind of think of two different possible futures. We do all this and we get great outcomes. Then what? How are we going to keep this? So, if you're thinking about that 3 years in advance, you're at a distinct advantage. The other scenario, though, that you need to think about is, what happens if we do all this, we implement the program, and our findings are disappointing? We're not getting the impact that we thought we were going to get. Because again, go back to my very first slide with the squiggly lines and the two professors at the chalkboard, and you need to be more explicit here about this miracle happening and getting these great outcomes. The reality is, you're probably not going to get the outcome. You're probably not going to get the full outcomes that you had hoped for. So if that's the most likely scenario, think about that and plan for that in advance. So then where does that leave us? Well, if we don't get the outcomes that we hoped for, the first question we should ask is, well, did we deliver the program the way we thought we were going to? Did we actually do the thing the way we thought we were going to, or the way we hoped to do the thing? Because if you didn't do the thing, you shouldn't expect to get the outcomes. Then that's a rational that's a rational result. And then you need to think, likewise, you need to think about, okay, well, what do we do then? Do we need to, is our sustainment plan, instead of sustaining the thing that's not producing good outcomes, is our sustainment plan, okay, how do we sustain a next phase of this prevention program that allows us to do some continuous quality improvement so that we can improve the delivery, and hopefully in the next cycle we will get better outcomes. So that, you know, the short answer to your question is, from the very first moment you're contemplating the adoption of a new prevention program, you need to be thinking about, if it works, how will I sustain it? If it doesn't work, what will I do then?
Those are all great points. I think it can seem really overwhelming for communities to be thinking about sustainability in that adoption phase, when there is that 2 to 4 year gap that you referred to, and you're hoping for the miracle that those scientists, you know, were talking about in the interim. And you talked about some of the planning that you can take throughout that process to make it more likely that you'll be able to sustain those programs long term. And I think that kind of the planning of that for that sustainability can maybe make it feel a little bit less overwhelming if you're thinking about this and taking like step by step by step by step. Are there formal ways of developing sustainability plans, and what might be some of those main steps within what a sustainability plan might look like?
Yeah, so you know, I touched on one of them in the beginning in this, when I talked about stages of implementation. So it's just not, so everything from implementation science tells us that that's the way it always happens. It's always those like 5 steps from, you know, contemplation to sustained implementation, and the 3 steps in between, the 3 stages in between. So we know that that's, if we go into it thinking that this is the way it's going to happen, this is the way it's going to unfold, we can literally plan for each of those stages. And in each of those stages, we have different needs. You know, we're going to be, you know, there's a point at which we will need to think about, what is the workforce necessary? Who are the practitioners? What skills and capacities and training do they need? If we anticipate that there's going to be turnover among those practitioners, those program deliverers, how are we going to plan to compensate for that? Do we have money in the budget, and do we have the time, and do we have access to trainers to make sure that we're retraining and recruiting new staff to make up for that turnover? So I think the one thing that is sort of fundamental in thinking about a sustainability plan, which again, I can't think about sustainability planning without simultaneously thinking about concurrent implementation planning. So sustainability planning is part of implementation planning, and we need to make sure that we're doing good implementation planning. And I talked about the funding challenges of prevention. Well, one of the characteristics of that patchwork quilt of funding for prevention is a lot of our prevention programming is funded by competitive short-term grants. So a lot of the service providers, a lot of the folks on the webinar today are probably very well versed in grant writing. You know, they're constantly writing grants seeking funding for a program. Well, when you're writing that grant application, and when you're writing that proposal for competitive funding, or even formula funding from your county, for example, when you're writing that proposal, that's implementation planning, and part of that implementation planning is sustainment planning. How we're, again, answering those fundamental questions. What do we need to deliver this really well in the way that we expect it to be delivered in the way it probably needs to be delivered to get the outcomes that we want to get. How are we going to monitor that implementation? How are we going to know that we're delivering the thing the way we intended? How are we going to know what impact we're having? And that sets us all up for, how are we going to sustain this thing if we are getting the impact that we anticipated? Part of that question is there something else that we're doing that we need to de-implement, right? So, one of the sort of epiphanies that I've come to after decades of working with community providers in trying to, pursue effective prevention programming and services is this myth of the empty vessel, like that there is some hole in their, there's some empty spot on their plate where they can add this new thing. The reality is, if you're adding a new program or service, you're probably going to need to get rid of something else. You're probably going to need to stop doing something else unless you significantly increase your resources. And when you do that, that creates a sustainability challenge. If you think about your current workforce and you say, okay, we're going to adopt this new family strengthening program, is there something that we maybe could stop doing and shift our existing resources towards this new program because we don't feel like we're really getting a lot of impact out of something else that we're doing? So de-implementation is kind of like it's the Bigfoot of sustainability planning. People don't ask the question, well, if we want to keep doing this, should we stop doing this other thing?
So in that planning, because there is things rarely work out perfectly, like you mentioned, that implies that there are going to be some barriers that communities will likely need to address as they are going through this process. What are some of the most common challenges or barriers to sustainability that it might be nice for communities to be aware of going into this process?
Well, I mean, so I think that if a provider organization feels like they're constantly challenged to sustain things because of this funding treadmill that prevention is often on, I think probably the two most common challenges are, one, that we don't think about sustainability until your funding is about to run out. I mean, that's what I've seen in decades of working with community-based organizations and provider organizations. It's just like, it's not natural to think about how we're going to sustain something 3 years from now. We don't make the time for that. And honestly, again, if we think about the scenario where an organization is submitting a proposal for some competitive funding to start a program, well, after you submit that proposal and you're waiting to find out whether it got funded or not, that's a time where you can do some sustainability planning. Or there's often you find out that you got the funding and it starts in a month. The grant period starts in a month. So now you know it's coming. You know that the grant period starts a month from now. Well, use that month leading up to that to say, okay, now there's the story you tell to get the funding, and then there's the story that you have to figure, the details that you have to figure out once you find out that you actually got the funding and you're going to be expected to deliver this program or service. That's the time to really buckle down, put your nose to the grindstone, think through all these details, and especially broaden your network of stakeholders and practitioners even more than maybe you already did when you were writing your proposal. To think about, okay, because that's an even better time to reach out and get to get partners and stakeholders, because now you can start the conversation with, hey, we've been funded to start this new program in the community. We want you to, to help us out and ride along with us and be part of our oversight body to hold us accountable. Oh, I'm sorry. And so that was the first. The first challenge is not thinking about it until it's urgent, until you're at the crisis stage. The second challenge, I think, is assuming that everything that you're doing needs to be sustained. Right? I mean, that's what we do. We just assume that we want to keep doing everything we're doing and do some other new stuff as well. And that's maybe not always realistic, and it's maybe not always true. I mean, there are some things that we shouldn't sustain because they're really not delivering the kind of impact that maybe we originally envisioned, and maybe it's not realistic, and maybe that it's just that things have changed, the needs of the community have changed, the evidence base around what works, or our knowledge about what is most effective changes, and so maybe it is time to drop something, and we don't have to sustain every single thing that we're doing. And I guess part of that is also, part of that is, as an organization, really having a well-defined organizational strategy about where does innovation and evaluation fit in the way we do our business. Like, what is the everything that we're doing, we should know whether it's having the intended impact. Everything that we're doing, we should know whether we're delivering it in the way we intended, or whether we're making some of these reactive adaptations that are program drift, that are probably hurting our results or our outcomes. But again, also thinking about how often are we trying to try new things? Because if it's too frequent, then your organization, you think about the whole menu of programs and services that an organization is offering. Most of those should be at that mature that mature stage where they've hit their stride, where they're at their most effective. It should be, there should be some innovation going on, but it shouldn't be the majority of what you're doing, because there's just too much chaos.
Great, thank you. Just everybody in the audience, we have about 10 or so more minutes with formal questions before we turn them over to your questions. So feel free to drop those in the Q&A so I can relay to right here in a couple minutes. All right, so what resources exist for helping program developers or implementers create a sustainability plan? I imagine that most developers and implementers probably don't have an innate or intuitive understanding of how to do these types of things. So what are the resources that can help with that?
Right. So before I came to Colorado about 8 years ago, for about 12 years prior to that, I was working in Pennsylvania, and I was directing this state level intermediary organization that was working with multiple state agencies to scale up a menu of evidence-based programs, like I don't know, 15 or so specific named packaged prevention programs with a manual and a training program and a developer and a purveyor organization. And so we had like these 15 examples of specific programs that we were trying to get communities to adopt. And so again, for every community that adopted one of these evidence-based programs, they would be faced with, okay, how do we sustain this after our initial seed grant funding runs out? And so that gave us a really concrete laboratory to try to figure out that answer of how does a community or a school sustain this program once the initial seed funding runs out. And so because we were working with like 15 very specific named packaged programs, we worked with the communities and with the program developers or purveyor organizations, national training organizations, et cetera, to develop a sustainability plan that was specific to that program, that really unpacked it and said, okay, what are the pieces of this that would need to be sustained? What are the budget implications for each one of those component elements of the program? Where are the likely funding possibilities if it's something that required resources? Sometimes, again, it's the sustainment is not necessary. It's not always about resources or funding. Sometimes it's about workforce, right? Or accessing the target population. So again, going back to this family strengthening program example, the biggest sustainment challenge for the family strengthening program is really recruiting families to come and attend the sessions, cohort after cohort, year after year. That's a sustainability planning challenge. So anyway, we at the epicenter, this intermediary organization, we ended up developing sustainability planning tools that were specific to each one of these programs. And I'm gonna actually drop a link in the Q&A. I think. Oh, maybe. Try. Yeah, so I dropped the link in the Q&A, and I encourage people to go to that link. There's a whole bunch of resources. They were developed with taxpayer funds, so they're all free. There's a bunch of webinars on specific sustainability planning topics. But what I encourage folks to do is go in there and look at one of the specific evidence-based programs that might be similar to the type of program that they're thinking about, because there are probably some universal ideas about what what could be done to sustain a program like that, like a school-based curricular program, or an after-school family strengthening program, et cetera, or a community mentoring program. So you can probably find a program that might be similar to a prevention program that you're thinking about, and you can maybe borrow some ideas from some of those resources.
That sounds good. Yeah, so EPIS is a wonderful resource, and an academic unit, a research unit that can support sustainment of evidence-based programs. Another approach are these community coalitions. People in Colorado are likely familiar with CTC, or Communities That Care, and maybe to a lesser extent Prosper. What role do community coalitions like those play in sustainability?
Yeah, so I refer to these as community collective impact models for prevention, where you organize a broad-based coalition of a lot of different stakeholders who are in different ways and in different roles that are all sort of collectively pursuing the same thing, thriving for families and communities. Like whatever you're doing, whether it's school-based or you're working in a county agency or you're in a community nonprofit, et cetera, you're all sort of on the same team. You're all in different ways in your own unique roles. You're pursuing this universal goal of improved outcomes for children and families and communities. So when we can get everybody together as a group, the idea is that there will be collective impact, that the sum will be, or the total will be greater than the sum of its parts, right? That you amplify each other's resources and strengths, and this has absolutely been demonstrated in research in terms of the outcome of sustainability, of being the outcome, the goal of being able to sustain prevention programs long term. It's been demonstrated that it is easier and you're more likely to be successful in sustaining if your program and your provider organization is part of a broader coalition, like Communities That Care or a Prosper team. And I mentioned one of the things before is that, when you have this broad network of stakeholders beyond just the organization that's actually delivering the service, when you've got a broader organization, they keep you accountable and on task. They're going to come back and ask you, how are things going? How many families did you recruit? How many lessons did you deliver? How's the fidelity of your program delivery? So that broader coalition can keep you, they're an accountability buddy. They're a constructive, critical friend. They're going to ask you the questions that you need to be asked to keep yourself on accountable and on task. They also diversify your network of supporters and champions, right? Obviously. So again, think about it. If you made the decision to adopt a program just within your organization, when it comes time to sustain, guess who's responsible for that? Just your organization. If, by contrast, you made the decision to adopt this program in collaboration, in conversation and discussion with a broad network of stakeholders who have different roles in the community and different, represent different constituencies, if everybody collectively arrived at the conclusion that your organization should adopt and implement this program, then they've all got a stake. They've all got an interest in seeing that program succeed, and they're going to be more engaged in wanting to help you sustain that program. So, that diversification of the network of supporters and champions, and amplifying the responsibility for the success and sustainment of the program, and they serve as a point of coordination across a diverse network of providers and services. So again, we always have to acknowledge the reality that what you are delivering is not the only thing going on in that community. The program that you are offering is not the only thing going on. And isn't it great when we can sort of map out all the programs and services that exist across the community and really think about, well, how do we optimize this whole network of programs and services so that we don't have like 3 programs trying to do the same thing and reach the same target audience. Meanwhile, some other need over here is not being addressed, or some target population is not being addressed. So that those coalitions like Communities That Care or a Prosper team, they can really, coordinate across this diverse network of providers and services.
I really appreciated your point that you made about amplifying the voice of prevention. I think that's also really important when, you mentioned that prevention is so often underfunded or an afterthought. I can imagine that those coalitions can just amplify the voice for prevention within communities and at the state level. So that was the last formal question that I had for you, Brian. I've got a couple in the chat or in the Q&A. The first one that I have is, can you share any success stories or two from sustainable, long-lasting programs?
Yeah, so one of the reasons that I kept referring to a family strengthening program as an example is one of the experiences that really stands out for me personally. When I was working in Pennsylvania, we scaled up the SFP 10 to 14 program, which I know you're very familiar with, Nate, and CSU is helping to support here in Colorado. We scaled that program up across Pennsylvania to the point where we had over 3,000 families a year across the state that were participating in this family strengthening program. And again, it was very challenging in the early implementation, in that initial implementation stage. Everybody was trying to figure out how to do this. I mean, if it was easy to get families to come to a family strengthening program, everybody would be doing it. The reason that there aren't a whole lot of parenting programs or family strengthening programs is that it's really hard work. It's something people don't just like want to take time out of their busy lives to go and attend a class to learn about how to strengthen bonds with their early adolescent children. So in the beginning, it was difficult and it was challenging, but the more we went through the more cohorts of this program we went through, the more lessons we learned about successful strategies. And then communities would start sharing their lessons across communities and saying, oh, hey, this is something that we tried. And sometimes they're just really idiosyncratic. Like, you really need to know your community. You really need to know what is important to people in your community, what pushes people's buttons. Like, what night of the week can you just absolutely not offer these SFP sessions because that's the night when the basketball team plays or whatever. And like, everybody in this community is really fired up about high school basketball or whatever. So the accumulation over time of these lessons meant that every new site that tried to adopt this program had the benefit of learning from all of the sustainability planning successes and failures of the cohorts that came before them. And that, just as an aside, that's one other reason for folks to look at evidence-based programs, evidence-based prevention strategies that have been proven effective in randomized trials. They've been out there, they're endorsed, they're on the lists, and lots of other people have already tried them, because then there's a body of knowledge and experience that you can draw from, you can borrow from. Folks had great ideas about there was a movie theater in town, and they went to the movie theater and they said, hey, at the beginning of every movie, you show some previews of other movies that you want people to come and watch. If we made a little 2-minute video about our family strengthening program, would you be willing to show that video before every movie? Because that's our target audience. The families that we want to work with they're taking their kids and going to the movies. So would you be willing to do that? And so they did that. And then the movie theater got so excited about having a socially beneficial role in the community that then they reached out and said, hey, is there something else we can do to support this program? So they said, well, could you give us some movie tickets that we could hand out as sort of incentives for people to come to these family strengthening sessions? So it just kind of snowballed. There was another rural community that I can think of where almost everybody in the community powered their home through, or heated their home, ran their washer and dryer, etc., through propane. Propane was the power source, the main power source for everybody in this rural community. And there were like 3 propane companies that were competing with each other to, for the business of the, limited number of families that there were in, or homes that there were in this community. So we kind of played those against each other, and we were like, oh, well, this propane company is giving us gift certificates or to the local Walmart or whatever as incentives. Is there anything that you can do? And so again, we started sort of creating some friendly competition, and again, after they got over that initial hump of giving some kind of donation, then we would, like, at the graduation night, at the graduation celebration at the end of the program, we would have a representative from the propane company come, and we would have all the families thank them and everything, and that just reinforced their participation, and that led to even more financial support and other types of support for the program. So that's one of the biggest, one of the most successful stories of scale and sustainment that I can think of.
Excellent. We've got one more question. It's an important one I want to make sure we get to. It is, how does sustainability look different across different cultures, including ethnicity, SES, rurality, etc.? How can existing sustainability frameworks be culturally adapted? So is there such a thing as culturally responsive sustainability?
Yeah, well, I mean, I think, I mean, that's a really good question. That's a really important question, and I think that idea of what I would describe as an equity lens in the whole approach to both implementation planning and sustainability planning, it's really important. And I think that, you know, that's an area that we're beginning to get more sophisticated about in our thinking. You know, I said that everything about sustainability has to be traced back to the fundamental questions of, are we delivering the thing the way we intended? And part of that is, are we reaching the people that would most benefit from the program? And are we having the intended outcome? Because you have to answer those two questions first before you can even decide whether you should be sustaining this program, or maybe whether it needs to be, you know, you need to do some continuous quality improvement and sort of tighten up the way you're delivering it, or the audience that you're reaching. And so I think that thinking of those two questions, that implementation quality and reach question, and what impact are we having, you really have to get to the level where you're answering both of those questions through an equity lens. Like you can say, oh yeah, you know, when we average our scores on our post-test, our pre-test, post-test change scores, when we average those across all the people that went through this program, the average looks good. Well, that doesn't tell you, you know, that's the average. And the average can be pulled up if you've got a small group of people doing really well, and at the same time, you have a whole bunch of people that aren't doing very well, right? That can pull up the average. So you really have to think about disaggregating your data. You need to think about who are the populations that you're really trying to reach. You really need to think about, is the program that you're delivering, is it culturally relevant to the population that you're trying to reach? And are the program implementers well connected to the community that you're trying to, and representative of the community that you're trying to work in? So yeah, I'm glad you brought that question up. I think it's a perfect you know, kind of last really important point to make, is that we need to go back and look at everything that I've talked about implementation planning and sustainability planning, and organizational capacity, and multi-stakeholder community coalitions. In every aspect of this, we need to be applying an equity lens to that, to make sure that we're not just promoting thriving as a, you know, on average, that we're promoting thriving equitably across the populations that we're working with. So thanks for whoever shared that question.
Yeah, of course. Well, on that last important point, that's about all the time that we have today, Brian. I really enjoy listening to you talk about this. You know, your experience influencing and being able to communicate all these really challenging concepts it's just great. I really enjoy it. And I really want to say thank you to everybody else who joined us today for this episode of the Prevention Research Center Prevention Extension Cast, and we will catch you next time. All right, have a great day, everybody. Take care.